Now coming to the second type of the classification, which is based on the mechanism of retention. So here the retainers have been classified into three categories again. Okay, so the first one is your extracoronal retainer. Extracoronal retainer. The second one is your intracoronal retainer. And the third one is your radicular retainer. So here the name only suggests extracoronal, that is from the external surface of the coronal portion of the abutment tooth. So here the retention is achieved from the external surface of the coronal portion, that is the crown of abutment teeth. Okay, so in this image you can see here, this is your external surface of the crown of the abutment teeth, and retention is achieved from this surface of the tooth. So this external surface of the tooth, if retention is achieved, then it is called as your extracoronal retainer. Now coming next to the intracoronal retainer. So here, as the name suggests, intra means from within, coronal means from the crown. So if the retention is achieved from within the coronal surface, of abutment teeth, then it is called as your intracoronal retainer. So example here are your inlay and onlay. Okay, and for the extracoronal retainer, the examples are your full veneer restoration, full veneer retainer you can say, or you can also call the partial veneer retainer. Okay, now here from the image you can see that the retention is achieved from within the crown surface, that is by the inlay, which is on the both side, and this is your pontic and these are your connector. So this is called as your intracoronal retainer because it has been achieved from within the tooth of the abutment. So this is your intracoronal retainer. Now moving next to your radicular retainer. So here, as your name is suggesting, the radicular retainer, radicular means root. So if your retention is being achieved from within the roots of the abutment teeth, then it is called as a radicular retainer. So example is, if the retainer is present on the abutment teeth which has been endodontically treated and they are having post and core restoration. So post and core are your type of the abutment teeth. If retention is occurring from the post and core type of the abutment teeth, then it is called as your radicular retainer. So in this image you can see that this is an endodontically treated teeth, and here you can see the support is majorly occurring from the radicular portion of the tooth. This is your radicular portion of the tooth. So that's why it is called as your radicular retainer. Now next classification is on the basis of material use. So here they've been classified into four categories. The first one is your all metal retainer. All metal retainer. Okay. The second one is your metal ceramic retainer. Metal ceramic retainer. The third one is all ceramic retainer, and the fourth one is your acrylic retainer. So here in these images you can see the different types of the retainer on the basis of their material used. So here in the first, this is a all metal retainer. The second, this is a metal and the ceramic retainer. The third, this is all ceramic retainer, and the fourth one is your acrylic retainer. Now let's know the difference between them. So coming to the all metal retainer, so this retainer is made up of metal. Okay, now what are its advantages? That it is having good strength. It is having good strength. This is the advantage, and it's require minimum tooth preparation. Okay, but the disadvantage is that it is not aesthetic. So can be used, or you can say indication is like can be used in posterior teeth. Okay, now coming to the metal ceramic retainer, here the lower portion is made up of metal, and it is covered by the another layer which is called as your ceramic. So it is also called as porcelain fused metal crown. Okay, porcelain fused metal crown, and this is most widely used because it is having the strength of your metal and aesthetic of your porcelain. So the advantage is that it is aesthetic, and disadvantage is that it require more tooth preparation as compared to all metal retainer. Okay, now coming to the all ceramic retainer. So the advantage of this is it is most aesthetic one. It is the most aesthetic retainer, but disadvantage is that it is having less strength and it require more tooth preparation. Okay, so it is indicated generally, indication is for the anterior teeth, whereas metal ceramic can be indicated in both anterior as well as posterior teeth. Okay, now coming to the acrylic retainer, so they are generally used for temporary fixation. Okay, if you are fixing some of the temporary retainers, then we can use this acrylic retainer. They have poor aesthetic, less strength, poor tissue response, so they are temporarily used. So this was all about the classification of the retainer. Next we will read about the criteria for the selection of the retainer.